Hi, my name is Shana Arvin, and I'm the student nurse today, and I'm going to perform a head-to-toe assessment. First, what I would do is I would come in the patient's room, I would introduce myself, and I would verify the patient's name and date of birth, and then I would perform hand hygiene and put gloves on, and then I would check the patient's vital signs. I would check the O2 stat and the temperature, and I'm going to check the blood pressure. Ah. That's not gonna work. I'll put this right here. Okay. Okay, so I got 1.6/82. After that's finished, I'm going to check the patient's radial pulse. Okay, so I got 84 for the pulse, and then after that, I'm going to check the respirations.
I did. I got it. I already have it.
Okay, so I got 19 respirations. After that is finished, I'm going to like make sure the patient is alert and oriented. I'm going to ask the date, the time, ask the patient if they know why they're here and where they're at. I can ask them questions like if they know who the president is or like what they had for lunch, and just make sure they're alert and oriented. So after that is finished, I'm going to the patient's top of the head and checking if the patient has any lumps or anything on the top of their head, and make sure that their hair is evenly distributed. After that, I'm going to look at the patient's eyes, nose, and ears, and make sure that they don't have any drainage and if their pupils are reactive. And then I'm going to go and look at the patient's mouth and see if they have all of their teeth, and make sure everything's normal, and make sure the patient doesn't look pale or anything. So after that is finished, then I'm going to listen to the patient's lung sounds. Go under the gown. And then I'm going to listen to the patient's heart rate. So after that is finished, I'm going to ask the patient to roll to their side to listen to their lung sounds on their back. After that, I will also look on their bottom and their backside to make sure that all the skin's intact and it's not red and it's not moist and everything's dry back there. So after that is finished, I'm going to go to the patient's arm and I'm going to check the capillary refill on each arm and hand, and I'm going to check the grips on each hand, and then I'm going to check the radial pulse on both sides. And I'm going to go up and check their skin trigger, and then I'm going to look and see if they have any IVs on each arm. So after that, I'm going to listen to the bowel sounds in all 4 quadrants. So I'm going to make sure that the bowel sounds are active in all 4 quadrants, and if not, then I am going to listen for 5 minutes. I'm going to ask the patient if they have any problems with swallowing and ask if there's any pain or discomfort with their abdomen. So after that is finished, I'm going to go down to the patient's legs and check if there's any edema and just see if the skin is evenly distributed. So I'm going to come down here and I'm going to check capillary refill on these. I'm going to check in between the toes. I'm also going to check on the bottom of their feet, on the heels, and make sure that there's not any redness or anything going on down there. I'm going to check the patient's butyl pulses too on both sides. And then I'm going to check the first skin trigger, and again, make sure there's no edema on their legs. After that, since my patient has urinary retention, I'm going to come back up to the abdomen and see if the bladder is distended. I'm going to feel it and see if it's soft or hard, and they also have a Foley catheter, so I'm going to check the lines and see if everything's clean, and then I'm going to look at the urine in the catheter and see how much the patient has voided, and see what the color is, the consistency, if there's any odor, if it's clear or cloudy, and just make sure everything is good there. And then also on my order, it says that the patient is going to have amoxicillin, but my patient allergy is amoxicillin. One of my patient's allergies is amoxicillin, so I'm going to consult the doctor and the physician and see if they can hold that medicine, just because my patient is allergic to that. After that is finished, I'm going to perform hand hygiene, and then I'm done.